Part 2,
previous
Mental
attempts.
Health and Suicide.
Okay. Letter E. E stands for ethanol or excessive alcoholism. Okay, so chronic alcoholism, these are people who loses control of their life. So it's also a risk factor for suicide. Let's proceed to R. R stands for rational thinking impaired. Okay, so if you are not rational anymore, you do not know what is real or unreal, you hear those voices in your head telling you to jump off the building because you don't know what's real or unreal, so most likely suicide will happen. That's impaired rational thinking or rational thinking impaired. Then let's go to S. Sad persons. The S stands for social support, that is inadequate or lacking social support. Do you have friends? I mean, how many of your friends do you really consider as true friends? Some of them are your friends when you are successful, but when you are in your lowest low, you can only know the real ones. Sometimes if you hit rock bottom, that's actually a learning opportunity for you to know who your real friends are. Well, let's go back to social support. You need social support. Everyone needs that. From your family, your friends, your loved ones. Imagine the power of social support. And without social support, there is no room for you to express yourself, to process the things that you are going through. So most likely suicide will happen. So lacking social support, if you live in isolation, you live alone, is a risk factor for suicide. That's the R, that's the S in sad person scale. Let's go to letter O. Letter O here. Okay. So suicide, remember, is organized. Organized, meaning it is planned. Suicide is always organized and planned, and therefore the good thing about it is predictable. You would know that a person will most likely commit suicide because of the cues that the person leaves, like leaving away prized possession, or talking about leaving this place, or going into a trip but there is no return. And that person will most likely end his life. So the good thing about it, since it is predictable, we can always prevent suicide from happening by instituting our safety measures and suicide precaution to our patients. How about N? The sad person scale. N, okay, studies have shown that no spouse is a risk factor for committing suicide. Okay. Although not all, it's just a risk factor, but not all without the spouse will most likely commit suicide. But those who committed suicide tend to live in isolation. Not only no spouse, maybe also a nagging spouse. Yeah. Make sure you choose, when you choose your partner for life, it's someone whom you can grow together with. Not that you choose a parasite, a parasitic relationship. Give and take nga, ikaw lang ang nag-give, siya naman ang nag-take. So the spouse is really contributor to the decisions in life. Okay. And the last one here, letter S in sad person's scale, is your sickness, chronic sickness. So some people would tend to end their life since they could not cope with the sickness that they have. So instead of suffering the consequences of, like, for example, cancer or CKD, they just would like to end their life while they can. So that's one risk factor. So again, let's review the sad person scale of those who are high risk for committing suicide. So you have S for sex, A for age, D for depression, P for previous attempt, E for ethanol or excessive alcoholism, R for rational thinking impaired, S for social support that is lacking, uh, O for organized or planned, N, no spouse or a nagging spouse, and S for sickness that is chronic. So there is an equivalent score for that and for analysis. I'm not going to tell you because this is not a substitute for an actual medical or psychiatric consult. So just remember those risk factors. And if you feel like you need professional help, please do seek consultation to your doctor or leave your message here at the comment below so I can direct you to the proper authorities or the proper agency that can help you with your whatever you are going through. Remember, it's okay not to be okay. All right, so I'm arriving here at our hospital, and thank you for listening and watching this lecture. Bye bye.